see a bunch of people have joined us. Okay. Okay, let's start perhaps. I can see many people have started to join us. Hello, everyone. Bonjour à toutes et tous. Hola a todos y todas. I hope you're all doing well. Welcome to an exciting session on monitoring, evaluating, and advocating for CSE and youth-friendly services. My name is Haya. I'm an advocacy officer here at FOS Feminista, and I'll be your moderator for today for another session by the Center for CSE and Youth-Friendly Services. And for those who are new to the space, the center is a global hub intended to serve as a reference point for exchanging and learning cross-regionally on CSE and youth-friendly services. It is coordinated by 4 organizations working on related topics. We have Ahung from Pakistan, CS Bolivia, Women for Change Cameroon, and FOS Feminista. And I know M&E isn't always the most glamorous topic, unless you're the kind of person who get excited about indicators, power maps, or competency framework. No judgment, I'm one of them. But trust me, today we're going beyond spreadsheet and checklist, and think of this session like putting on glasses to see the work more clearly. The tools that will be shared are not just about measuring, they're about learning, adapting, and advocating better. And today you'll hear from 3 of our co-hosts who turn big challenges into practical, powerful tools. So let's explore these tools together, let's explore how they support service quality and accountability, reframe what success looks like in CSE and youth-friendly services, and help connect the dots between classroom, clinics, and communities. Feel free to bring your coffee, tea, or drink of choice while we let people in. This is meant to be an energizing, engaging space. We will have Q&A where you can put all your questions. Please make sure to do that. You will find it in the banner at the bottom. I also need to highlight that we have interpretation. We have Spanish, French, Portuguese, English interpretation. Je vais partager ça en français aussi. Il y a d'interprétation français, anglais, espagnol et portugaise. Et vous pouvez cliquer sur euh, le globe pour avoir l'interprétation. And sorry. And we will be recording the session for today. And yeah, to kick things off, we'll start with short presentation from each of our 3 speakers to get a sense of the tools in action. Then we will have more of a panel discussion, some Q&A questions to the speakers, and then we will have a space for the Q&A. We have Ruben from FOS Feminista, who will start up, my colleague here, to share on the CSE Teaching Competencies tool, a tool that helps us reflect on the competencies of those delivering CSE, not just what's being taught, but how. So over to you, Ruben.
Thank you, Haya. Just give me 1 second to share. Can you see my screen now?
Yes, go ahead.
Great. So, how are you? Good morning, everyone. It's a pleasure to be with you presenting now, and especially because I have the pleasure to present to you a very interesting resource that we created from FOS Feminista, and we've been working on this in the last few years in the framework of a project that we had in Latin America and the Caribbean, where we were trying to advance the ACE and youth-friendly services. And the first thing is that I would like to thank some of the people who were part of this process, of this tool. On the one hand, we have the social science programs from Flaxo, Argentina. That's a very important cooperator of FOS Feministas for the advance of CSE in the region, and they participated actively as well as other collaborators in the development of this tool. We also like to thank the CEPAM-G from Ecuador, GRPA from Guyana, CS from Bolivia, PROMSEX, and in Paris from Peru, who are the organizations that helped us in the with the development of the tools and the pilot tests. And then once the tool was created, they implemented or they tested it in the real world. So this tool was developed and tested in Latin America and the Caribbean, but we were really careful to design this tool so that it had the possibility of being applied all over the world. The tool is available in Spanish and English for the moment, and we hope that it is useful for everyone in the session today. The tool is called, it's a tool that analyzes CSC teaching competencies, and it takes as a basics or objective the capacity of analyzing the skills or the competencies that a person has when it comes to teaching these CSE. So one of the important thing is that we did not want to constrain this tool to educators, and that it's in educators in the formal educational system or schools, but we wanted this tool to be a tool that could be used by any other person that facilitates these CSEs programs, either online, digital, or in communities, or any other intervention that the components of these tools is what this tool tries to channel. And we had two frameworks. The first one was the technical education guidelines created by the UNESCO, International Technical Guidance on Comprehensive Sexuality Educations. And we all know that this is our bone marrow regarding the CSE. And the second is the use of the teaching competencies. And this is very popular in all the educational systems, and this was an approach that was applied in the last decade, and it talks about the competencies that a person has. In this case, it's an educator, so as to be able to give classes or share the knowledge with students. So we took care, well, we using this teaching competence approach as the basis, but we adapted this so that it could be more flexible. And as I said, so that it could be used by any person that is working on facilitating a CSE, regardless of whether this is done in the formal, in a system in schools or not. So what is the first objective of this tool? Is to identify strengths and areas, opportunities in the process of facilitating comprehensive sexuality education, ensuring the CSE meets its objective. So we're always talking about how to measure the impact of CSE, but it's important that before measuring the impact, we also need to take into account other areas of learning or the facilitation of CSE. So this tool aims at complementing other existing tools and focusing specifically on the process of the facilitation process regarding the teacher or the facilitator of CSE. And also considering that a person that teaches or facilitates CSE should do so with the necessary competencies in order to facilitate it in the best way, because ultimately this is a mechanism so that people who have access to CSE can really learn. And with that, well, that the CSE meets the objective of providing information to people regarding sexual education. So the tool is made up of two main phases. The first part has to do with the introduction um, and a self-analysis process. So the tool is made as by a series of smaller tools. So in this first part, we have a self-analysis tool, and this is a document in which the facilitator, before going to the second part, that is an external observation process, this person has the possibility of analyzing the topics or which are the different values and attitudes and everything that will be reviewed in the second stage of the process. Now, in this case, this self-analysis tool is not as such as a part of the competencies analysis. There would be no qualification or rating, but this is a process of accountability with the person that will be participating in the process. So this could also help, because this is what was told by us in the piloting cases, as an exercise for the facilitator itself, himself or herself, so that this person can understand or get to know more about themselves, what are the things that are not still developed in order to facilitate CSE. So this is the first stage. Now, the second stage is a bit broader, and this is called external observation. Now, this external observation, as I said, is made by smaller tools, and we start with a review of documents, and this is going through all the materials, all the documents that the person will use for the facilitation of CSE. Something that is very important to mention here is that first, the tool is designed to implement it in CSE strategies that are made of several sessions, and this tool is recommended to implement in a mid stage of the implementation of all the program. Why? Because the tool will be making questions that if we implement it initially or towards the end, maybe this not necessarily will have a good perception, because it talks about how the facilitator works with the young people receiving the CSE and things like that. So this is the first point. And the second point is that in each of these small tools that make part of this external observation, there's a process of rating or according to a result. So these has three ways. That is not developed competencies or competencies in development and developed competencies. So here, as you can see in the green part to the bottom, this is where we have the parameters uh, and the person implementing the tool can establish whether the facilitator has the competencies or not according to these scores. So we have this is a tool that is a document review form that goes through all the documents, and also together with guidelines of CSE, we analyze that these documents really meet what is needed in order to facilitate the CSE. The second is the observation of the session, and this includes a series of questions in the tools, and the person implementing it will observe how the facilitator facilitates and how they answer to these certain questions. So this goes from the content in the syllabus and also the way this person interacts with the people that are involved in the teaching process. Then we have an interview with a facilitator so as to, engage in a conversation with a facilitator by means of questions that are already established. As you can see here, the interview questions, and this allows us to have um, a more critical perspective, if you want, of the person when we are making a specific questions about the perceptions that this person has now once the session has already been implemented. And then we have the interview with participants. And this is also a very important point because this is not only what is observed by the person implementing the tool, but also the perception of those who participated in the session. And so all these tools that are part of the external observation process will have some kind of final result. And as I said, well, this is based on a score, numbers, but it also relates to meaning that has to do with undeveloped or in development or developed competency. So towards the end, you have all the results, all the scoring, and we also have an allocation of what could be a total assessment regarding the competencies of the person. So once again, we have not developed competencies in development or developed. So this is just to have a unique assessment or result for the person participating in the process. But at the same time, we like to mention that, in fact, each part of the external observation process has a way in that it could be in which you could address it. Why? Because here, for example, maybe you could have that the person has competencies in development, but then maybe the person did not do very well in implementing the CSE, and then when it has to do with a feedback or when we generate training sessions, we have to base ourselves in these competencies that were not developed. So, and with that, and this is where I want to close, this is the most important part. It's not a question of rating how a person facilitates the CSC education, but to find the areas of possible improvement so that the CSC teaching can meet the objectives that it is aimed to meet. And that would be everything from my side now.
Thank you so much, Ruben, for the thoughtful presentation. It's great to see how the tool is not just about assessing competencies, but it's about empowering educators to reflect and deliver CSE with confidence and care. We will come back to you shortly in the panel, but next, let's turn to Ramiro from CS, who will walk us through the IDA certification tool. And this one is all about making adolescent-friendly services more than just a buzzword through measuring what matters across CS Arch. So over to you, Ramiro.
Hello, how are you? Greetings, everyone. Thank you for the space. And we are really glad to share with you our experience regarding the evaluation of youth-friendly services or attention, interest, and desired actions. And as we know it here in Bolivia, I will be sharing this experience and to socialize our knowledge. And in case of any consultation or question, we will be here to answer because we consider that we've had an experience that has really made us to position ourselves regarding a specific model of service and care for youth and adolescents. And I would say that we've had very favorable experiences.
Me indican, por favor, si pueden ver mi pantalla.
Can you please tell me whether you can see my screen?
Not yet. Okay. Let me see if I can. Oh, now we can see it. Over to you, Ramiro.
Perfecto, muchísimas gracias. Disculpen el
Thank
problema
you.
técnico. Bueno,
Apologies for the
como les
technical
decía
issue.
anteriormente, es un
So
placer poder
maybe
participar en
as
este
a
momento
previous
instaurado que
experience,
hemos
I think that when the
priorizado el
CSE was
trabajo con adolescentes, con jóvenes,
implemented at a
con
national
otras
level, we have
poblaciones en
prioritized
cierta
the work
situación de
with teenagers,
vulnerabilidad. Y en
adolescents, and
este
other
sentido
youth
es que
population
hemos
in
impulsado
vulnerability
campañas de
situations. And in that
coordinación
sense,
con los
we
ministerios
have
de salud y educación,
created
esto
a care
relacionado a
model
poder
coordinated
responder
with
a
the
las
Ministry of
necesidades de
Health and
adolescentes y
Sports
jóvenes
that is related to
relacionados
respond to the
también
needs of
con las necesidades
adolescents and youth regarding
insatisfechas
health,
también
and
de
also to
ciertas
respond to these
sexualizadas y
unmet
reproductivas. Y en ese sentido, pues
needs
tengo para
regarding
ustedes
health,
compartirles algunos
reproductive health,
trabajos
and
también en
uh,
coordinación con el ministerio, con el
sexual
Comité para la
education. And
Certificación de
we
Establecimientos
have
de
this
Salud,
tool in coordination with
la
this
Comisión
certification tool
Interagencial para
that has to do
Especialistas de
with
Comunicación en Sanidad
differentiated
Especialista en
integrated care.
AIDS.
And
Simplemente comentarles que
this is
esto
the
ha sido
certification
trabajado
of
también desde la
ADA,
coordinación
and this is
interinstitucional,
something that we've
desde
been working with
acuerdos
the
con los
interinstitutional
diferentes
coordination,
ministerios,
with agreements with
representantes
different
estatales
ministries.
del Ministerio de Salud y Deporte.
And in this
A partir
case,
de
it's a
acá, pues hemos
Ministry of Health and
logrado
Sports
instaurar
coordinated
un
everything,
proyecto
and we've
modelo
been
de
able
atención
to
en
install
Bolivia
this
y también
care and
hemos
service
logrado
model
hacer
in
que
Bolivia,
se
but
convierta en
also
un proceso
we were
continuo
able
en
to
donde se
turn it
operacionalice
into a
lo que
continuous
satisface
process
aquellas necesidades de
that
adolescentes y
really
jóvenes. Y bueno, como les
can
comento
satisfy
acá,
the
no
needs
voy a
of
decir
adolescents
que es
and young.
integral
So this
diferencial
is the
para
care
adolescentes y
model,
jóvenes, es
differentiated
el mismo modelo que conocemos
comprehensive
como
care for
servicios jurídicos para
adolescents.
jóvenes.
And this
Solo que
is
acá
also what we
tenemos
call
unos
as
diferentes
youth-friendly
detalles, pero los
services
componentes son
for young
similares y la
people. We call it
respuesta a las
by a different
necesidades
name, but the
que se
components
tienen,
are the
a las
same, and the
necesidades insatisfechas, como les
responses
comentaba,
to the
son muy
needs to
similares.
unsatisfied needs are also similar, as I
Y
said.
nosotros consideramos que es
Now,
importante
why do we
evaluar
consider that it's important
consideración
to
este aspecto,
evaluate
pues
it,
creemos que
these
es muy importante que
services
consideremos
with this
promover
tool? Because it's very
servicios que
important
sean
that
inclusivos, que sean
we believe it
accesibles y
helps us
culturalmente
to
pertinentes también.
assess
Es
inclusive, accessible, and
una evaluación
culturally
que se
pertinent
realiza a todos
services as
aquellos
well. So this is an
establecimientos
assessment that
que
is done
consideran
to
que
all
brindan un
the
servicio
different
a adolescentes y
organizations
jóvenes y
or
creemos que es
establishments that
importante
provide services for
hacerlo,
the youth
monitorear,
and
evaluación para
adolescents. And
realmente
therefore,
poder
it's
cumplir con
important to do a
aquellos
monitoring and
indicadores
assessment to
establecidos
see
de
whether they are
adolescentes.
complying with the
Simplemente acá
indicators
podemos
established within this
sugerirte que
tool.
se
Now, its
mejore
implementation also
continuamente los
allows
servicios,
us
que se
to
garantice la
do
calidad
a
de la
continuous
atención para
improvement of
todos
the
los
services and
adolescentes y
care,
jóvenes, solicitar
guaranteeing
que estos
the quality of
sean
the care and
certificados
services for all
y
the
también en su
youth that have
cumplimiento
access to
identificar
these
aquellas
certified
otras
services, and also
accesibilidades
so
que
that
se
we
pueden
can
necesitar al
identify
momento de
the
implementar este
strengths
modelo
and
de atención.
weaknesses that could
Además,
be
esta
present when it
evaluación
comes to implement
permite
this
a que los
care
diferentes establecimientos de
model.
salud
This
se
also
concerten
allows
para
different
implementar este
health
modelo, puedan
care
obtener una
establishments that
certificación
implement this
de
model
atención
may
integral
obtain this
deseada, ¿no? A partir de
certification
un reconocimiento
of
que el
this
Ministerio de Salud
differentiated
y de
comprehensive
sus,
care model. So here we have an
digamos,
acknowledgement of this
representaciones
certification
locales
from
del
the Ministry
Departamento
of
de Salud, los servicios
health
departamentales
and
de
the
salud en los
local
diferentes
organizations
departamentos
or health
existentes.
department at the different
La
areas
herramienta de evaluación
existing.
que
So
manejamos,
the
como les
assessment
comentaba,
tool
es la
that we
guía de
handle
supervisión
is a
de indicadores
guideline
de
that
establecimientos AIDA,
oversights
que se
the
integran con
different
búsqueda
indicators
adolescentes.
of
Y bueno,
the
es un
ADA
instrumento
or this
técnico que, como les indicaba,
comprehensive
hemos logrado
care for adolescents, and we've been able to work in a coordinated and interinstitutional way with the Ministry of Health in order to be able to assess in different sections and based on different indicators everything that we consider that is necessary to establish within an organization in order to verify that this care model, according to the specific characteristics, is in fact implemented and it really responds to those needs. And it also allows more dignified development of youth and adolescents. So this tool has an introductory section where we have all the general data of the health establishment and of the technical team that will assess this establishment. So this tool is divided in 9 sections, and these sections are in turn divided in indicators. And aside from these indicators, we have some that have an assessment done by the youth to the healthcare service, but also evaluating the health staff regarding the service and the care they received. Now, how is this tool applied? Well, we have two ways. One is internal, that is done internally by the healthcare center, and one that is external, and this is done by the health department, and in order so that they can validate that in this healthcare center is implemented this care model. And in order to verify that a health care center complies with all these indicators and that it really is providing service and care under this model, is that this establishment or center should at least comply with 80% of these indicators so that it is considered an effective model. And as I said, within the indicators that we have to verify and assess this differentiated care model, we have these: accessibility, available services, adequate information, confidentiality, networks and local alliances, awareness and training, the performance of the staff, availability of drugs and inputs, and also contraceptive methods and feedback that could be made by the teenagers and the youth. In the accessibility, well, we need the service or the center to be located at a place that is easy to reach and that it has a wide spread of schedules, that there's no economic, cultural, or administrative barriers, and that there's a clear and inclusive signaling, both internal and external, so that the service and as such could be identified by the users and that they can identify the different spaces where they can have access to this care model. When we talk about available services, we mean that there should be a comprehensive package regarding sexual and reproductive health, mental health, and nutritional health. So we talk about the availability of counseling and individual care, also the promotion of a preventive approach to health. And in case the healthcare center cannot respond to a need that the young or adolescents may have, then they should refer them to a corresponding area with which the care center is related to. When we talk about adequate information, we believe that this should be provided in a clear, accessible, and an easier way, comprehensible way, free from all type of prejudices, with accessible language, with material that is adapted to the young adolescent population, and they should be informed regarding the rights to education, sex, reproductive education, confidentiality and privacy, and also an active participation in the design of different materials, and that the message should be in coordination with the youth and adolescents that are related to the service. When we talk about confidentiality, we mean that the privacy should be guaranteed and the medical records should be handled with discretion, and nobody should have access to these documents participants, unless, with the exception of the person involved and the medical staff providing the care. And also the staff should respect the autonomy and confidentiality of adolescents, and to provide care in companion of some people if they wish to, and respective the intimacy. When we talk about the coordination of institutional educations, municipalities, youth organizations, civil society organizations of NGOs, they should also carry out community activities for the promotion of adolescents, and also carry out intersectorial work that reinforce the comprehensive care, because in some opportunities there may be adolescents that resort to the service, and maybe they have some other need, or maybe they have gone through a violence situation. So in that sense, this intersectional work makes that if the healthcare center cannot respond to these needs, then they can resort to the corresponding instances, that is the ombudsman or the legal offices at a municipal level.
Awareness and training. We need continuous training of our staff for differential care under a gender approach, sexual and reproductive rights and human rights, diversity and intersectionality. Of course, we also talk about awareness activity, decent treatment, and of course, this has to be led by experts within the health system and other allied institutions that can support the training and awareness process. And of course, when we do the assessment and the implementation of this tool, and we talk about training and awareness, well, through this process, we need verification so that we can consider that the indicator has been achieved. We have technical reports and certificates that have been granted that are used for the assessment, and also evidence and coordination by other institutions are part of the process. Staff development and work, they need to be empathetic, they need to be motivated, they need to respect cultural, sexual, and gender diversity, they need to have the training to actively listen and establish reliable and trust relationships. And to verify this, we have supervision for the staff with the authorization of the adolescent in order to confirm that all of the services are being provided, and we need to verify that the staff is providing updated information, whether care is comprehensive, reference to other types of services, verify whether the information is proper and timely. And when we talk about availability of drugs and supplies, access to and contraception is timely requested by adolescents or in answer to any need or treatment requirements, availability of supplies and devices that allow differentiated care such as weight, telemeters, densimeters, and other devices that allow us to provide comprehensive care, and also to have control and registration and inventory of the devices, and also the possibility to have access to these supplies, such as, for example, contraceptives. Another example in the process is that related to feedback from the adolescents. This is a mechanism that allows us to gather the feedback from adolescents through surveys, interviews, and suggestion boxes. And then we assess the information received through surveys and also through the engagement with healthcare services These are differentiated comprehensive care services for young adults and adolescents. One of the most important indicators is this one because it allows us to visualize whether we are providing correct answers to their needs and requirements, and also doing an assessment through engagement with their active participation. And of course, it must be horizontal. And afterwards, we assess and analyze suggestions, and we also implement suggestions. And as I said, engagement in consultative groups by adolescents so that we can answer the indicators that are assessing differentiated care for teenagers and young adults. Within the assessment process, this is something that allows us to verify that we are complying with at least 80% of the indicators. First, we need a self-assessment. Within the self-assessment phase number one, the staff reviews whether we are complying with the 9 indicators. We have the checklist, and we identify the weaknesses and strength to then elaborate an action plan to deal with the weaknesses and empower all strengths. And then we go to phase two, which is an external assessment plan through which the center that has already finished the self-assessment requests external audit or external assessment, and the assessors and the auditors who will be leading this through a committee that is coordinated by the center, involving other adolescents and teenagers that are also part of the committee. Of course, we have different committees or adolescent groups that are seeking to prevent teenage pregnancy, violence, also to prevent transmission of disease. And these articulations are linked to, as it is, to do the assessment. Then we verify the existing documentation to see whether they are complying with at least 80%. And if this is so, and we can verify, then the health center is certified as being able to comply with at least 80% of the indicators. If they have a favorable assessment in the internal audit, but not in the external, they do get the certificate, but then together with CERES, they go through a change order process so that they can finally receive their certification once they comply with all of the checks and balances. We have had continuous coordination in 1984 when CS was funded. We have been able to promote sexual reproductive rights, and we have been coordinating with the ministry. And through this coordination, we have been able to make this service better until we achieved the certification granted by the ministry. At least all of our centers at CS have been certified, and we can say that we have very favorable experiences that have allowed us to position ourselves as an institution, and we thus were able to provide services and technical assistance in consonance with the local ministries, and of course have national coverage because we have centers in the 9 Bolivian departments. All of these 9 departments are providing differentiated health care for adolescents, and we also have 7 of our healthcare institutions in 7 national centers.
English, just being mindful of time. I think it will be great to cover the implementation side within the questions that we're going to have in the panel just right after we finish up with the presentation from Ahung. So just being mindful of time, let's just jump back to Ahung and then get back to this presentation. We're really sorry about that. Just because we only have a couple more minutes for that. And thank you so much for the very insightful overview of the idea. Adolescent health services are not only available but truly responsive, and youth-centered. But just let's travel back to Pakistan, where Kumal will present the power mapping tool. And just like a spoiler alert, it involves intense discussions about who actually holds the power in education policies, and it's a very participatory, political, and effective tool. So over to you, Kamal. And
Thanks, Haya. Thanks, everyone, and hello to everyone who's here with us today. Thank you so much for joining us. Really good presentations by Ruben and Ramiro. So just gonna dive into it and share my screen. Are you able to see it? Sorry, I think, Haya, you're the only one I can see. Okay. Okay, perfect. So my name is Komal Kidwai, and I am the Research Learning and Evaluation Manager at AHANG, which is an NGO, a non-governmental organization based in Pakistan. And our focus is SRHR, Sexual and Reproductive Health and Rights. However, a core component of our work is comprehensive sexuality education in and out of schools. And our locally adapted term for comprehensive sexuality education is life skills based education in Pakistan because it's more culturally acceptable. And it's also been referenced in our local policies. And so we decided to use this term rather than calling it CSE. And so just a little bit of context. On the Pakistan situation that we have on CSE. Sorry, I think my slide is stuck. I don't know if it's moving for you. Can you see it move? Or now it's moving. Okay, perfect. So Pakistan, for those who may not be familiar, has one of the world's largest youth population. And we don't actually have comprehensive sexuality education integrated as part of any official legislature or policy anywhere across the country. Education for us is a provincial and a state mandate, which means that every province gets to decide their own curriculum and education policy, etc. And so one consequence of this is that the integration of life skills education, or CSE, is uneven across the country, and there's no national standard for whether or not it's being implemented or how it's being implemented. The cultural and religious context in every province also differs greatly, and so a lot of our advocacy efforts are also fragmented, different, scattered, and there has in the past been a lack of clarity on which stakeholders are most relevant and powerful and need to be targeted for advocacy in which region. And so to help improve and systemize and streamline our advocacy, Ahang had developed an advocacy mapping tool for the purpose of integrating CSE into our education curricula and into our education policies across our provinces or states. The purpose of the tool was to identify key actors who have decision making, who have influence, and who also have financial power. Then to understand what the stance each of these actors have. Are they supportive? Are they in the middle somewhere where they are movable and we can influence them? Or are they opposed? And if they are opposed, then how strong is their opposition? And then finally, we wanted to, of course, build strategic advocacy pathways for each of our different regions. For context, we have 4 provinces and then other governed territories. And everywhere there's a different context, different governance. So the way we understood power mapping to be was that we considered it to be a visual participatory analysis of our stakeholders. And we categorized actors, again, like I said, by type of power, by the level of power, and their stance, particularly on CSE. So for us, this power mapping is not just really a technical tool, it's a really participatory process because it helps stakeholders to visually map out the landscape of influence so that we can then make informed decision about how to prioritize our advocacy. For example, how to identify people who are in that movable middle and then work with them, lobby with them to influence policy decisions. And the step-by-step tool process I'll just walk through. So the first step was to identify all relevant actors. And so because the primary stakeholder that we were looking at was young people, particularly school students, but also out-of-school youth, one way was to identify who the gatekeepers and primary decision makers are in their lives. So that turns out to be parents, school administration and management, teachers, education policymakers, those who are in the government education departments, for example, curriculum designers, assessment, those who run the assessments for students in schools. And so all of these actors have a role to play in what ultimately gets to students in their curricula and their assessments. And so we identified all of these actors. Then we got them together to identify who the decision makers are in terms of policy integration of CSE into the curriculum. And so first, this group, which is conducted in the format of a discussion, they identify relevant actors, and then they classify them by the type of power that they have, which can be financial, or it can be decision making, or it can simply be influence. Once they identify, then we move on to map the direction of the influence and to say whether the impact is positive or negative. So it's not just about identifying who is in opposition, but it's also about seeing who is already in support or those actors who are neutral so that we can push them to harness our advocacy more, to improve our advocacy, to use them as champions to push our goals forward. So the whole entire process is super hands-on. Actors are identified, and then their power is ranked. So you can use, for example, we facilitate a discussion in which we can use buttons or beads of some kind. And then if I am ranking a curriculum designer as a relevant stakeholder who has power, then I'm going to put the same number of beads that I think represent their power. So if a teacher I think has less influence than a curriculum designer, then a curriculum designer would be represented by 4 beads, for example, and the teacher would be represented by 2 beads, for example. So I'm ranking the degree of power of each stakeholder in this discussion as well. And then once participants have done that, then of course there's a debrief discussion, and then we ask them questions. For example, why do you feel like our curriculum designer has more influence or has more power than, say, a teacher who's standing in the classroom? This is just an example, of course. So the key stakeholder categories that we have used just to kind of bring this back to the real world have been education ministers, secretaries, and this includes bureaucrats who are actually implementers of whatever legislation or policy we are able to change. And then also, of course, curriculum boards. these are decision makers because they are influencing what is actually getting into the classroom and into the content of both the teachers and the students. Strong influencers are religious leaders, nonprofit organizations such as ourselves, donors, media, because they influence public discourse and debate, particularly in the context of Pakistan. Religious leaders influence public discourse on CSE because it is often framed as a religious issue, and they do want a say in what kind of content reaches students. And then potential influencers, for example, can be parents, teachers, other young people who influence their peers, etc. Another example is also school management committees and parent committees at the school. So the result of the activity looks something like this, where the actor is identified, and then the nature of their influence on the outcome, which is the curricular integration of CSE, is identified, whether they are a positive or a negative influencer. Then the nature of their power, for example, are they decision makers? Are they more financial influencers? Or are they just influencing discourse? And then the level of power. So again, the size that I explained, that the participants had made an influence pile. So whose pile is higher, that means that person or that stakeholder has higher influence. And then what is their influence on other actors? So for example, if teachers are in support of teaching CSE, but they do not have support from school management, then we would end up seeing a lack of implementation on the ground level. And so we have to map the many levels of power that we all have on each other, all these stakeholders have on each other. So this is what the result of the activity looks like. I'm just going to share a couple of examples. So for example, in one province, we found that tribal elders and political parties are actually key influencers rather than, say, the education department itself or bureaucrats, because we felt that if political parties are in support of CSE, if they're able to support this discourse around CSE, then they have enough influence over the bureaucracy to be able to implement something like this. However, in the province of Sindh, for example, we found that there's a lot of urban religious influence. So those religious leaders who are based in urban areas are incredibly vocal, and they are often in opposition to CSE. And they influence discourse. So they will influence both, they will try to influence bureaucrats on the government side, and then in the private sector, they will try to influence private schools and school associations to prevent them from adopting CSE, for instance. So these are just some examples that we were able to identify of stakeholders and their influence through this mapping. Here's just a quick example of what the mapping activity looks like. So on one side, we have those who support the objective, those who oppose the objective, and then the y-axis is high power and low power. So for example, you can see here that the media is somewhere over here. So they're in support of CSE, and their power is somewhere close to the middle. So they have a degree of influence, but of course, then they're not decision makers. Whereas the education minister is right on top and is going to be leaning on the side of slightly opposition, but also close to the movable middle. So that tells us that we can lobby with this minister and then try to push them towards integrating CSE. And then we also see that some of them have all three. So for example, the education minister is also the decision maker. They also have financial influence, and they also have just influence in terms of setting discourse. So there is a lot of overlap also. So we're kind of keeping that intersectionality in mind. So just kind of just to comment on the outputs is just that they are stakeholder specific advocacy strategies. And we were able to develop provincial power maps from this, which helped us to enhance alliance building and inform our communication strategies So, for example, what kind of message needs to be put out to what stakeholder to better influence them and to keep and to further our goal, which was integration of CSE in curricula. So the strengths of the tool primarily are that it's very context sensitive, it's very participatory, it's easily replicable by anyone, anywhere, and it generates good and practical advocacy insights. And the only kind of challenge or kind of thing to keep in mind when implementing the tool is that power, the way we define power, has to be intersectional, that there may be bias in how stakeholders are perceiving the definition of power, how they're perceiving stakeholders. And of course, we have to keep in mind that influence pathways are incredibly complex. And so it has to be completely adapted to a local setting. So, for example, in the case of Pakistan, you can't even have one way of doing this at the national level. You have to do it by each province or each region and constantly update it. So, in conclusion, the tool has worked. It has allowed us for evidence-based advocacy. It has strengthened our local CSE integration strategies, and we have ended up building long-term alliances for not just CSE, but also SRHR improvements in each province. And that's it.
Thank you. Well, in fact, any tool that allows to assess the services gives us the opportunity of identifying strengths and weaknesses. And from an institutional point of view, this has allowed us to make this model of service and care more robust. And it also allowed us to enter a continuous assessment process that relates the active participations of youth and adolescents in different spaces, not only spaces in order to state their needs and to look for joint responses, but also to be able to make decisions within what will mean all the actions of our healthcare centers based on the delivery of youth-friendly services.
Gracias, Ramiro. Ruben?
Thank you, Ramiro. Thank you, Hayam. Well, on our side, I think that there are two specific parts that I would mention. The first that has to do with the opportunities that the tools gives, and that is based on analyzing the competencies, we can identify which are the topics or which are the specific skills that the trainings for those that facilitate CSE should include, or they should focus on. That is, the the issue of training the CSE facilitators, both in formal schools and interventions outside the schools, it has always been one of the important gaps that we have, and we know that they exist. And I believe that with this tool, we can help inform and make visible what are the needs in terms of training. And on the other side, and I think that Haya mentioned it very well, this is not a tool that necessarily aims at assessing the person, but it aims at supporting the person or accompanying the person in this process of facilitating the CSE. It could be in terms of providing support, empowering the person with skills and abilities that allow them to make it better. And as other colleagues that were part of the piloting said, in some cases, it's important to listen to the facilitator because they need to be listened. And this can make people who facilitate feel that they are doing something and that they have a support and that there is a structure that is offering outcomes and results and leading the change. So that would be on our side.
Thank you so much, Ruben. Just gonna jump to Kamal before we move into wrapping this. Over
Thanks,
to you, Kamal.
Aya. So I think in terms of reframing goals and shifting advocacy strategies, I think one of the key things that mapping advocacy in this way and shifting our understanding of power in this way does is that instead of looking at things from a top-down level, we started looking at it from a multi-layered approach. So I think what we learned, for example, in the case of Pakistan, is that you could have an education minister or a population minister who is openly coming and supporting CSE or certain kinds of services. But then when you go down to the implementation level, still nothing is going to happen because those designing the curriculum have decided that, well, this isn't relevant to us, or we don't want to do it, or we're opposed to it, so we don't agree with it. And so because of identifying these imbalances in power and these shifts, I think one thing that we were able to do is make the advocacy multi-layered as well and reframe our goal from like, well, we need to change this politician's mind or we need to change this minister's mind to we need to work at every single level, both at the decision-making level, but then also at the implementers and influence all of those levels with our advocacy strategies.
Amazing. No, thank you for the three of you. I think you've all covered all a similar pattern on having a participatory approach, on having more of a down up approach and looking into the intersecting levels of it. I think that also connect to maybe the second question that we had on how are you using these tools to reimagine what success looks like in CSE and user-friendly services? Because often metrics are prioritized numbers, how many are reached, how many trained, but as feminist practitioners, we know that quality, dignity, and agency matters. So for you, how does the tool reflect on these different understanding of success? Whoever would like to start.
Should I just continue?
Go ahead, Kamal.
So I think that's a really good point, and I think this tool kind of helped us to think beyond numbers because usually we're reporting against some kind of log frame, and it's like, well, we had this many meetings with this many policymakers, or we influenced this many policy documents. But with this kind of power mapping, I think that we started measuring success in terms of shifts in relationships and attitudes. So, for example, if we know a stakeholder was previously resistant, how has their stance changed? So when you repeat the advocacy mapping more than once, you can track that change as well. You can see how space has been created for dialogue versus maybe somewhere it didn't before, like a curriculum bureau, for example. So it also looks the success then I think also looks like, you're building that grounds up support and legitimacy for CSE instead of just saying that this is the number of documents we've influenced, for example.
I agree. That's amazing. Thank you, Kamal. Ramiro or Ruben, would you like to add anything on this question?
Yes, maybe I can now. Thank you. Well, just in the same line as what Kumal says, we believe that it's important to have tools that allows us to assess the numbers or the figures, but we cannot stop there only with figures and then cold numbers. It's very important, as we said a while ago, to be able to relate all the community as a whole, because we believe that the different contributions that different sectors can do that are working with a healthcare system, they are essential to be able to offer more comprehensive responses. That is the liaison with educational units or the liaison with services that protect the youth and the adolescent. This is essential so that these services of differentiated and comprehensive attention can be essential, and so that the youth can have a dignified life. And we have been able, through our experience, to certify 9 healthcare centers, but many care centers from CS out of the 10 that we have. And this has also allows us to make visible the work with the community, and the youth protagonism especially is essential. We are convinced and we believe that we can do nothing without the youth unless they are involved in the process.
Amazing. Thank you so much, Ramiro. And youth engagement is absolutely the most crucial part of the work on CSE and user-friendly services, and really great to hear all of your insights. Ruben, would you like to add anything from your side?
Yes, I will be fast. I believe that for us, this was a really important part of the project on which several of the discussions were made when we were elaborating the tool, was to think the evaluation and monitoring process as processes that support, and not only processes that qualify or rate or give a value to the work done by people. Because at the end of the day, this tool is a tool on CSE, and initially this was implemented in Latin America and the Caribbean, but the context is not simple, it's not friendly, and just generating tools to have access to data that allow us to do one thing or the other, that shouldn't be the only objective. That is, assessing shouldn't be the only objective, but to support people who are involved in these processes as facilitators, so that we can not only have numerical outcomes, but really to have an insight of what is going on at the different spaces.
Amazing. Thank you, Ruben. And yeah, I mean, to have active participation and meaningful engagement, that's definitely what we need. I think I just want to flag that we have Q&A, and if the box that you can add, and I can see some people have started to add some questions, and Kamal kindly answered one of them. So we'll just do one last question, or like our last question in the panel, and then we will delve into the Q&A, but please feel free to add more of your questions so we can answer them for the last 20 minutes of our call. But lastly, and thank you all for the very insightful presentations and food for thoughts for today. But if we would like to link everything, if we could build a feedback loop between the 3 tools, and or like one tool and the other 2 tools mentioned, or any other tools that might not have been presented but you are aware of, how would that look like if we imagine a more connected ecosystem between advocacy, service delivery, and education, how could the tool inform or be informed by the other, and what kind of transformation would that enable? So passing, sorry, my laptop making some noises. Hope that wasn't very loud. Over to you, Ramiro, first, maybe.
Thank you. Maybe from an institutional point of view, we were able to implement an educational program. And this program, what it does is to articulate, and it relates specifically these three pillars: differential attention, CSE, and advocacy. So in this sense, even though we have not done an assessment, and I believe that this is a huge challenge for us, I believe that we have advances, and this would enable us to dream of something a lot, greater, relating the integrity of these services and the delivery of these services. And we've been able to work with teachers implementing CSE, and precisely these are who contribute with information regarding the CSE services, and they also channel these health campaigns with the educational units, and where are the institutional staff, they provide a service taking care of the confidentiality and privacy, and also taking care of the integrity and the delivery of these services. We have strategic alliances with the network that is called Tu Decides, or You Decide, and we articulate with this organization because we want to have this youth engagement and participation in this process, so that we can guarantee that these are youth-friendly services and differentiated, comprehensive attention and care in Bolivia as such, and also CSE and the elaboration of these different proposals and legal frameworks that also embrace articles and things that aim at doing this liaison or this linkage, including youth, because we are talking about the youth-friendly services and advocacy.
Amazing. Thank you, Ramiro, for sharing that and having an actual linkage on the ground. Ruben?
Well, I think that Ramiro has already mentioned an important part, that is how we can connect all this in a circle that works in a cohesive way, so that these interventions are not disconnected, because the CSE provides information so that people are aware of the rights, and they can make informed based decisions, and at the same time they can have access to sexual and reproductive health, and that these services are youth friendly, so that all this is achieved. And how is this achieved? Well, by doing advocacy with decision makers, so that all this information is available. So being able to connect all the pieces of the puzzle.
Amazing. Thank you so much, Ruben. Kumal?
I think I have pretty much the same comments as both Ramiro and Ruben. And I think if we're able to identify, um, who the decision makers are, lobby with them, but then also with, for example, competencies, we're identifying barriers in the classroom. So then the next question is, well, who has the power to remove these barriers? So then that feeds back into advocacy, and because of CSE and through CSE, of course, we do end up with people identifying needs for services, and that's where the youth-friendly service bit comes in. And then, of course, to ensure that the services are also of high quality. So all of it, again, nothing is in a silo, all of it fits together.
No, exactly. And thank you all for sharing. I think and this is also where these kind of transnational learning sometimes help in filling out these gaps and connecting the dots between like different tools, different organization working on something similar that could be reflected in another country or in another context. So really grateful for all your comments and feedbacks on this. I can see we have a couple of questions. And I can see Komal and Ruben are already like responding to some. So I'm not gonna not gonna take these since you're already responding to them. But we have a question on for Latin America presenters. Apart from referral to access contraceptives, do school refer cases of learners who seek safe abortion services? Um, I'm not sure, Ramiro, if there's anything you can respond to on that from the case of CS's work.
Yes, of course I can. At the different services that we have, we can detect violent situations, and not only taking the need as such. This is a complicated issue because of the context that we're going through, and that teachers can refer to public services, but usually they refer the students to us so that we can analyze all the possibilities of respond to the needs of youth and adolescents. One of the main causes for which they refer it to us is precisely due to sexual violence, so that they can have access to legal interruption of pregnancies.
Amazing. Thank you so much, Ramiro. I can see there's two questions that are kind of related and to the three of you. One is, how do you take into consideration limited financing for institution implementing CSE in evaluation criteria for nuanced analysis? And another one is on accessibility, specifically in case of disabilities, but also if there is financial instability and how to make the tool accessible. So first, let's respond to the part on limited financing, and then maybe we can delve into the disability part. So whoever would like to take that question, over to you.
I can start if you want. Regarding the constraint of resources, definitely I believe that in the case of the tool that I was presenting, that is to facilitate the CSC, I believe that this is a tool that does not address specifically this topic, but at the same time, it's a tool that can be used to a certain extent as a tool that could be integrated to the advocacy process in formal education, because we could say, okay, we will have outcomes as to how this process is facilitated, and we can do an analysis as to how this is being implemented in an efficient and with quality, in an efficient way and with quality. And on the other hand, I also believe that it's important to consider that with the organizations where the piloting was done, the reflection that they made is that the tool could be adapted to the needs or the possibilities of each organizations, because some, for example, trained staff or trained to other colleagues of the educational center so that they could in turn implement the tool among their colleagues. In other cases, they trained young people regarding CSE so that they were able to implement it. So it is evident that we will not only have a specific person to lead the process. When we do have it, then it's so much better because it is better. But when that is not the case, then we try to train other people so that they can implement the tool. And on our side, what we did is to have a user-friendly tool so that this process shouldn't or be generated by hiring a person that had a lot of expertise, and maybe an organization could not necessarily cover the cost of having such a person.
Sorry for the short delay while I was hearing the interpretation. Ramiro or Kamal, would you like to add anything on this question?
Sure. Yeah, I think I agree with Ruben as to these tools being able to be applied to different kinds of contexts and situations. And I think Ahang is a really good example of that, because we have worked with elite private institutions also, and also really low income institutions. We have worked during times of good funding. We've worked in times where funding was super limited. And so, for example, in times when we have financial stability and we have enough staff, we are even able to implement a very similar tool to what uh, FOSS is using to track, but we're doing it in a mobile app form. So those institutions, who have access to smartphones and devices and internet access, so those schools can report their data back to us in that way. And then we don't necessarily always need to have a designated staff person. So even if you have one trainer and the data is coming to you organized in that way through a digital source, then that kind of saves you that human resource also. But on the other hand, we also have implemented a similar thing to what Ruben was saying, where if there's like a master trainer, like a trainer who's been trained by our own staff, then we know that they have the competency to be able to evaluate their own colleagues, and then we get the information from them. So that cuts down kind of one step and one additional resource of us having to send a person and spend that cost to assess and monitor.
No, amazing to hear. And I mean, that's what we have technology for. So it's great to see that you're able to still use that to get the feedback needed. So great feedback. Ramiro, over to you if you want to add also anything on these questions.
Yes, I would like to add that the tool that we use in Bolivia for youth-friendly services is a tool that has a national reach established by the Ministry of Health. So its implementation is guaranteed in some way, because each departmental service in the different territories and at local level, they have a person that is responsible for implementing these services, and it is this person who is in charge of doing the assessment and elaborating the plans and doing the monitoring of this implementation of this care model, because healthcare service in Bolivia is public, as well as the access to contraceptive methods. And also we have a universal insurance that guarantees the provision of healthcare services as such. And we also offer grants for the services, efficient services for the youth. We have also committees that evaluate this integrated healthcare service, and they are responsible for assessing the compliance and doing the monitoring. So this also allows that any person that comes to a public run institution, they can implement this tool without a lot of complexity. It's an easy to use tool, and once you apply it, you can have different parameters of compliance, and this facilitates the implementation quite a bit.
Amazing. No, thank you so much. I think we've covered, we've covered almost everything. And there's also, I want to tell people that we've already responded to an additional 7 questions in the Q&A. So if anyone wants to check that, if anyone have any other questions as well, please. We have four more minutes before we end our call or our session for today. If there's any other remarks, I can see. Yeah, no, they are all responded. If there's any other remarks from our speakers for today, from Ramiro, Ruben, from Kamal, please do. And if anyone has any, not necessarily a question, but any, I don't know, feedback, aha moments about the tools or like that has been sparked to you through the tools, please also feel free to share. Okay. Okay, with that and with, sorry, I can see. Okay. Yeah. So with the last 3 minutes, sorry. Okay. Checking the chat. So we will also share with you the tools, and I can see that my colleague Ruben has already posted one of the tools in the chat or in the Q&A. We will also share the tools or make them available to you after this call. And thank you so much for joining us today and for staying with us for the full hour and a half. And of course, thanks to Kumal, to Ruben, to Ramiro for the incredible insights. And I hope everyone walk away not just with new tools, but with new questions and ideas. And let's keep building systems that center young people's right voices and realities. And yeah, thank you so much and have a very lovely day, evening, or afternoon. Bye, everyone.